Hey, hi. This is Gautam. Welcome to Module 2 of this learning series, in which we would be learning to value a healthcare provider. Okay. So before this video, I've made a few videos on understanding financial statements, how financial statements are linked together, and then I made a video on financial statement analysis or financial ratio interpretation of this way company, Kowai Medical Center and Hospital. Okay. And then I also put up a video on wherein I introduced the concept of valuation at a high level. Okay. And which I called module one. Okay. So in this video, I would spend a few minutes discussing the hospital industry. Okay. So for any valuation or equity research exercise, it's very important that you get a good grip on the industry in which your company is operating in. Okay, because see, some of the data points that you come across while you analyze the industry, you could use those data points in the valuation or in the of the company or in projecting out you know their future financials. So those data points really could come in handy. All right. All right, so let's get started. So when we talk about industry, you obviously a lot of people, there are different frameworks out there. I tend to kind of think about the industry across these three broad buckets. First is the market size, okay, as to and how big the industry is, and how is it big vis-a-vis how big is the Indian market vis-a-vis the global market, and how is our company placed in the Indian market? Like what's the market share, you know, so on and so forth. And then what are some of the growth drivers which could perhaps enhance the market size of our industry moving forward? Okay, so it's very important to kind of understand them. Okay. And then what are some of the key trends, which are or key themes which are there in that industry, okay, which could perhaps impact the profitability of your company moving forward. Okay. And then obviously the Porter's five forces is a great framework that's actually used a lot. Okay. So Porter's five forces is the threat of new entrants, supplier bargaining power, uh, customer bargaining power, threat of competition, and competition itself. Right. So uh, let's analyze this industry. Okay, so there are a few good sources. When it comes to hospitals, obviously the annual report is a great source. A lot of companies, they have a dedicated section which is called the management discussion analysis. So that section is dedicated to industry of whatever company the whatever uh, it's dedicated industry the company is in. Okay, so we look at the annual reports as well. Okay, and then there are some other sources like there is a source IBEF, which is the Indian Brand Equity Foundation, which is a great source. Okay, so let's pull it up. Okay, let me uh let me pull that up. All right, so this is the Indian Brand Equity Foundation uh, report on healthcare. Okay. So let me scroll through it. Okay. Now, so healthcare is a broad industry within healthcare. We are obviously concerned with hospitals. Okay, and obviously there are other functions which make up healthcare. All right. Okay. So now let's move forward. Let's try to. So this is the market size. So in India, the total market size is 372 billion. All right. Now this roughly translates to around 30 lakh CR. Okay. So that's what the that so this is the market size of the entire of the entire healthcare sector. Okay. And within that, if you read through this document, you would see that 80% of it is hospital. So 80% of 30 lakh CR. So it's around 24 lakh CR is actually hospital. So hospital, they kind of make a significant chunk of this industry. Okay. Right. So, and obviously it has been growing at a rapid pace that you can see that in this chart. Yeah. And then you see uh, this entire healthcare industry, the expenditure in healthcare, it's only 1.8% of GDP. Now, if you compare it with a developed economy like the US, in the US, the healthcare expenditure, again, it doesn't just include hospitals, includes the other healthcare functions as well. So in the US, this is around 18%. Okay, all right. So and in India, it's closer to like 2% or slightly more now. Okay, so again, US and India very pretty different countries. Now let's look at some of the trends in healthcare. Okay, see the first trend is shift from communicable to lifestyle diseases. All right, an interesting metric that we have is around 50% of spending on inpatient beds is for lifestyle diseases. Okay. So this has increased the demand for specialized care. In India, as you would know, a lot of patients with diabetes and heart diseases. All right. So and those are like lifestyle diseases. Right. So that's a not so side trend. That's been there for a while in India. All right. The other is expansion to tier two and tier three cities. This would be a big theme, not just in healthcare and perhaps in other industries as well. Okay. There is a lot of focus on tier two and tier three cities. Okay. In fact, we'll see later that government is actually giving incentives to open up hospitals in these tier two and tier three cities. All right. Now let's look at some of the other trends as well. Increasing penetration of health insurance. In fact, I valued last year, in fact, last year, I valued a health insurer, that Star Health, and I also valued ICICI Lombard. Okay. So health insurance is just beginning to pick up in India. Okay. And it has pretty significant implications for hospitals. All right. And I did cover it when I made the video on financial statement analysis of this company, Kowai Medical Center Hospitals. So the implication is twofold. So when patients they have their health insurance companies pay for the medical treatments, then there are two implications. One is that usually health insurance companies they already have negotiated packages with the hospitals, and they are priced lower, okay, than than the usual pricing, okay. And the other is that usually these healthcare insurance companies they don't pay like right away, okay. So they take a while to kind of pay the hospitals, all right. So it has implication working capital on account receivables because the hospitals they don't get money for a medical treatment for a service they provided right away. They get it later. Okay, so there's certainly a working capital impact. Okay, and certainly some of hospitals are seeing it. Okay, and we also saw that Kowai actually hasn't seen that impact yet. Okay, but it will. Okay, once they have those patients, they start getting a larger footfall of patients which have their health insurance company, which are who are covered by health insurance. All right. Okay. So now let's take a look at some of the other trends. All right. So now let's talk about a major growth theme. Okay. That's has already kind of started playing out. That's medical tourism. Okay. So it would be it's a major growth driver for India's healthcare sector. All right. So I've marked some of the interesting points here. Right. So in India, a surgery costs approximately 20% of what it costs in developed countries. That's why you have so many people flocking in India for medical treatments. All right. And then there are a couple of other interesting data points. Okay. That Indian medical tourism was valued at 2.89 billion in 2020, and it could increase fourfold by 2026. All right. And the next one is that in FY19, India saw close to 700 or 7 lakh foreign tourists. All right. Now let's let's do some back of the envelope math to kind of make sense of these numbers. Okay. Now I know these two numbers, 2.89 and the 700 or 7 lakh, they are from different years. But if say they were from the same year, okay, then let's see what maths we could do. Can we use this in our valuation? Because that's really the point of looking at these numbers, right? To kind of understand if we could use these in our valuation. All right. So we're talking about like 8 2890 million divided by 0.697. So it would be closer to around $4,000 per patient, right? So I think that time the exchange rate, and I know the denominator is from a different year. So perhaps in FY28 would be slightly more than 700 or 700K patients or 7 lakh patients. So you would be perhaps slightly lower than $4,000, all right, which is fine. Okay, so $4,000 times the exchange rate, which was 75 at that time around. All right. So it would be closer to 3 lakh rupees per patient. All right. So again, so it's very important to kind of do that back the envelope math, when you kind of look at these data points and also try to think, and perhaps just note them aside and then try to think as to how can you use them in your evaluation. All right. Say if your hospital is experiencing a lot of medical tourism, all right, then you have to kind of project out revenue from medical tourism for your hospital. All right. Now, this is a very interesting data point. Around 3 million beds will be needed for India to achieve the target of 3 beds per 1,000 people. All right. So what it is saying is, and I actually did some more research, is that in India right now, per 1,000 people, there are 1.3 beds. Okay. The average, the ratio that World Health Organization WHO recommends is 3 beds per 1,000 people. Okay, so what it means is India actually needs around 3 million or 30 lakh more beds, to kind of get to the recommended average. All right. So this is a very interesting data point, right? And then it has another data point on doctors, that we need more doctors and we need more nurses, right? Okay. All right. Now let's take a look at some of the other growth drivers in this industry. So in fact, in the previous page, talk about rising income, aging population will be a key healthcare driver. So if you look at this chart, the per capita GDP in India is around $3,000. In China, it's around $12,500. It's more than 4 times, just for context. And so, and also the size of the elderly population is set to rise from 9.9 CR to around 16.8 CR by 26. All right. So again, if you with rising incomes and with changing demographics, with you they would be a huge driver for this industry. All right. All right. So now let's go to the annual report. Annual report is also a very good source of information on the industry. Okay, so let me open up their annual report. Okay. Right. So this is the annual report for this company. This is the latest one. Okay. And ideally, you should not just look at the latest one. You should look at, last 5 or last 10 annual reports. Okay. So let me go to the content section. Okay. So usually this message from managing director, this section, okay, and this section, management discussion analysis, they have a lot of good information on the industry. Okay. Message from managing director, or chairman message would tell you, would kind of have some sound bites over the industry, okay, and how the company is actually placed in that industry. And then management discussion analysis would have more information on the industry. Okay, so let's take a look at these two sections. Okay, and of course there are other sections as well in the Sun report. So we'll cover, uh, obviously we'll cover financials, when we get to the valuation part, and but some of the corporate governance and directors report we'll cover when we go to the corporate governance module. All right. For now, let's focus on the industry. Okay, so let's go to this section, message from managing director. Okay. So they talk about investing in latest technologies. Okay. And they gave an example that they have upgraded the pulmonary medicine department with several top-end diagnostic equipments. Right. Okay. And then they also talk about the acquisition of a cryoablation system for cardiac arrhythmia. And I looked up what cryoablation means. It's a technique which uses extreme cold to freeze heart cells that cause irregular heartbeat. Okay. And then they talk about some other medical disciplines. See, so when I was looking at their annual reports, not only this year, the past annual reports as well, one recurring theme that came out was their their investment in latest technologies across multiple medical disciplines. Okay, about new medical, uh, about new treatments, about new techniques for treatments. All right, so they are actually investing heavily in that front. All right, so and we'll look through some of that. Okay, see, besides some of the uh, you know quantitative information that we want to pull out, some of this qualitative information is very handy. All right, because that would help you make kind of make that judgment that has to how your company kind of stands out, or how is it different, how it differentiates vis-a-vis its competition. Okay. uh, so, and obviously if it's able to differentiate, we'll have more customers flocking in, it will have more revenue, so everything eventually would translate to financials. All right. Okay. Now they talk about the one that I've highlighted. They talk about the medical college. Okay. And they talk about that they are offering free treatment. They are offering low price treatment in their medical colleges. Okay. And again, this has implication in our valuation. And we saw it in the when we covered the financial statement analysis of this company, that the average revenue per bed was actually was falling down. It's because of the medical college. Okay, that they are required to give conventional treatment to patients in the medical college. Okay, and so again, so the point being that when you're reading this, always kind of take notes and think about how it's going to affect your view of the company, both qualitatively and quantitatively. Okay. And they talk about some satellite centers. They have one in Kowai, Coimbatore. They have three satellite centers in Erode, Sulor, uh, Koval, Palayam, so which are places around Coimbatore. Okay. All right. Now let's go to the management discussion and analysis section. Okay, I think it's page 30. Uh, okay. All right. So let's talk about some of the trends. So the first trend is medical robotics. Okay, they talk about digital surgery, surgical robots. Okay, let's we'll revisit it. Okay, and then they talk about lifestyle disease. Again, these 2 points: lifestyle disease expansion to tier 2, tier 3 cities. We already covered. We already saw these 2 points in the IBF report. Okay. Now, again, here's an interesting soundbite. The number of medical colleges in India, they have increased by 70% from 387 in 2014 to 660 in 2023. Okay. And the number of MBBS seats, they've actually almost doubled from 2014. And the PG seats have more than doubled. Okay. So again, these are like interesting data points. All right. Now let's scroll further. Then they talk about this certification NABH. Okay. Now, so this is required for uh, patient safety and quality of care. Very interestingly, okay, when I was researching some of the other very small cap, micro cap companies last year, bunch of companies IPO'd last year. Some hospitals which IPO'd, some of them they did not have this certification. See, they're not required to have this. Okay, but in this industry, you should always have certification, some kind of attestation, which kind of attests your facility that what you actually provide, like good patient safety and quality of care, right? So in which ways it was an interesting find that those micro cap companies do not have this. certification, and you are required to have it if you want to have like medical, if you want to treat foreign tourists, okay, which is obviously a very good source of revenue. Uh, right. In all fairness, those micro cap hospitals are very small, okay, very small. So perhaps they'll get it at a later point in time. All right. Now let's look at what else that this report has. They talk about again some opportunities that we've already covered in IVF, medical value travel, and preventive healthcare program. Okay. And then let's talk about some of the threats. Now, this is interesting. Shortage of skilled manpower. See, in hospitals, doctors are a major pull factor. Okay. Uh, so you need to have a good team of doctors, nurses, support staff. Otherwise, you would not really get patients, right? And that's why the fixed cost in this industry is pretty huge. Okay. And because you still got to pay your staff, your doctors, regardless of whether you get patients or not. Okay. And that's why this industry has a lot of operating leverage as well. And again, I covered this point in the financial statement analysis video that I made. Let's say if you have in 1 month, you have say 20 patients coming in and you have 5 doctors. So with that same staff, you could perhaps treat 30 patients next month without increasing your staff. So you have more revenue coming in with the same cost profile. Okay. All right. Now let's scroll further. Now they talk about uh, how their hospital, their company is placed, in along with these industry trends. So they talk about the new treatment option for cancer. In fact, they talk about that they've imported a new machine, a new equipment from Israel, which is called ICE Pure Medical. And this system is the third system in India and the first in South India to be installed. This speaks a lot about this company, that they continue to invest in the latest technology out there across multiple medical disciplines. Okay. And as I said, this is a recurring theme that kind of stands out when you kind of read their previous annual reports as well. Okay. And now they talk about, remember I said I'll get back to the robotic digital surgery theme. So what they're saying is that they've invested in robotic surgery and the robot is Da Vinci. And this is very interesting because I covered the company that in the US that makes these robots. I actually analyzed that company 3, 4 years back. I think it's been a while, so I don't remember a lot about that company. But it's a very interesting company, and these robots are being used a lot in the US. Uh, so I was like, uh, you know, I was pleasantly surprised to know that this company, this hospital, is also invested is also using these robots. Okay. All right. So and then if you scroll further, again they talk about that they are a leader in transplant surgery. See, some of these things could be a little self-serving. Okay. So always take everything with a pinch of salt, and that's what makes the job of an analyst hard and fun at the same time. All right. Okay. All right. So if you like scroll forward, you would find that they talk about some of these latest techniques and how they've used these techniques in treating patients. So there are some case studies that they talk about. Right now, let me open up, okay, another report, okay, before we head to the next module. All right. So this is annual report from the year 2020. Okay, when COVID actually had hit. Okay, so uh, let's take a look at the message from managing director. Okay, and what we see off the bat, what we see is that they talk about that they started medical college in this year. Okay, with an intake of 150 MBBS students affiliated with Dr. MGR Medical University. So what it tells us is that they started a college, and obviously you're going to use this in our valuation. Okay, because this is a stream of revenue for the company. All right, so you need to know when it started. Okay? And then again, we were talking about the recurring theme of they getting the latest technology across different medical fields. Okay, so here they talk about Department of Radiotherapy and where they have purchased this latest equipment. And I looked it up. It's actually used to take accurate images of tumor. All right. Okay. And what's interesting is that using this tech, this would allow them to treat double the number of patients. All right. So see, all of these qualitative sound bites, they definitely have like financial implication, right? So should think about it when you like value the firm. Okay. All right. Okay. Now let's with that said, let's so I think if hopefully it like gave you some understanding of 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 the industry. Now let's head to the next module. All right. So we saw multiple things uh, while analyzing the industry. So let's quickly summarize. Okay. So the first thing was, so let's market size. All right. So let's see what data points we looked at for market size. Okay. So here I've summarized. Okay. So for market size, okay, we saw the market size of the hospital uh, function of healthcare alone is 24 lakh CR. Okay. And healthcare expenditure as a portion of GDP is around 2% or slightly over that. Okay. The bed penetration in India is 1.3 beds per thousand people. And the WHO recommended ratio is 3. Okay. All right. But see, this is for India. Okay. But please remember, okay, that this hospital is a regional hospital. Okay. It's there in the Congo region. Okay. So we also need to know, I think we all need to kind of do some digging and need to find out what's the bed penetration in the Congo region. All right. So that is something we may have to kind of dig in further. Okay. To a certain what's uh, what's Kuwait's market share in the region that they operate in. All right. That is something we have not done. And we may have to do it. Okay. In the next module. All right. And so this kind of, in a nutshell, kind of summarizes what we looked at in the market size aspect of our industry analysis. Now, let's quickly summarize the growth drivers that we looked at for this industry. Okay. The first one is medical tourism. Okay. Now, this data point is a little dated, but what we calculated is INR 3 lakh per foreign patient. Number of medical tourists visiting India back in 2020 was around 7 lakhs. This number may have increased, uh, but for Kauai, we would not really be modeling medical tourism because they don't really do a good job at reporting the number of medical tourists that they get. Okay. Unless, yeah, of course, we can email the management and request for the details and provide they're willing to share those details. All right. So we would kind of sidestep this source of revenue because this any which ways is implicitly getting covered within the inpatient within the inpatient source of revenue. All right. Okay. That will obviously model the next module. Okay. And then another growth driver that we looked at is aging population in India and then higher income. All right. So people would obviously pay for healthcare and obviously would pay for, uh, you know, would be proactive in paying for their uh, healthcare for their parents. All right. So next is tax incentive to open hospitals in tier 2 and tier 3 cities. The government is providing incentives. All right. So that is another growth driver. Okay. For more number of hospitals coming up in tier 2, tier 3 cities in India. The next one is not a very desired growth driver. That is the lifestyle diseases like diabetes, uh, heart diseases. All right. So that also is a growth driver that will lead to more patients flocking in the hospitals. Another growth driver, which we touched upon in the market size section as well, was the low bed penetration in India. And because it's well below the recommended bed penetration limit, so that's why you could see more number of beds, more number of hospitals coming up in India in the future. All right. And again, the risk of repeating myself, we spoke about India, but we need to focus on Congo because the company that we are modeling is not pan India, at least not right now. It's focused, it's present in a small region in India. That's the Congo region, which is in the southern India. All right. Okay. The next one is, so let's look at the key trends. Some of the key trends, or from a Potter framework, okay, from a Potter lens. Okay. So the first, one of the key ones that we observed was the health insurance penetration and how it's going to impact hospitals. It's going to adversely impact profitability because the prices would be standardized. Okay. And it also would lead up to more account receivables, which would adversely impact working capital over time. Okay. So all in all, what we're saying is the bargaining power would be shifting to health insurance companies over time. All right. So bargaining power is one of the important five forces. Okay. And so again, we need to be, when we kind of model the working capital, okay, and also the profitability, we need to be cognizant about this. We need to uh, cognizant about this health insurance penetration, that how this could impact the financials moving forward. All right. Next one is the latest new techniques for medical treatment. And as we know, as we would see, uh, 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 that Kowai is actually investing very heavily in new technologies, new latest medical treatments. So the positive impact of that would lead to higher footfall of patients, higher realization, because they may be able to charge more for those sophisticated treatments. Okay, which would also, may also lower the average length of stay of a patient. Okay, because I'm presuming that those treatments would be more effective. They would be they would reduce the average length of stay of a patient. And again, so this could be a significant competitive advantage for Kowai vis-a-vis its peers, right? Okay. And again, competitive advantage is one of the aspects that we look at in the Porter's five forces framework. Right? And there could be others as well. Yeah. All right. And so the other things that we looked at while analyzing the industry, while looking at their annual report, specifically the management discussion analysis and the message from the managing director, those section of the annual report. The other things that we looked at is uh, we saw that this industry is a high fixed cost industry. Okay. And again, we touched upon this when we analyzed their financial ratios as well. Okay. So I've kind of, I think, so I've made that point a couple of times earlier. Okay. That this is a high operating leverage industry. Okay. Because of it has a high fixed cost profile. Okay. And obviously there is a flip side to this, is because if you don't have a lot of patients coming in, you still got to pay your staff, you still got to pay your doctors. All right. And then the other aspect, what we saw is the opening of medical college. So medical college typically, okay, whenever a private hospital or a hospital or any hospital for that matter, they open a medical college. Okay, it provides the hospital a good source of junior doctors. Okay, and always there's this fight for good talent. Okay, so it provides a captive source of uh, junior doctors, okay, which would lead to higher footfall of patients, due to, because obviously if you open a medical college, you need to treat patients at a reduced fee, so it would lead to higher footfall because of lower average revenue per operating bed. right? So, and again, we should be mindful of this factor when we model the revenue in the future. All right. So this was, the summary of our industry analysis. So we'll use some of this information, and we may have to kind of dig for more information, some of these, dig more into some of these data points as we go along in the next module. All right. All right. Okay. So see you in the next module. Thank you.